Hello, my name is Ali Haider, and today's date is October 20th, 2022. Today I will be doing the case connections number 4. I will be responding to case number 3 and case number 4 questions. Case 3. Gout is a type of arthritis that presents symptoms such as pain and redness in various joints. The patient's test results indicate that their plasma urate levels are elevated, about 10.5, while their urinary uric acid levels are pretty low, 215 mg for 24 hours. Best explanation for the presentation of gout in this individual is the overproduction of purines. Hyperuricemia is caused by overproduction or under excretion of uric acid and is the underlying cause of gout. Purines are metabolized into uric acid via the purine metabolic pathway. The uric acid formed in the blood then goes through the kidneys and is released from the blood in the form of urine. Uric acid exists primarily as urate in the blood. Increases in purine concentrations leads to increases in uric acid. Increases in uric acid concentrations can cause severe kidney diseases like kidney stones, chronic kidney disease, kidney impairments, and such. Kidney stones and other kidney impairments can cause a blockage in the urinary system, leading to a decrease of uric acid present in the excreted urine sample. A decrease in urinary uric acid typically causes high levels of urate in the blood plasma. Elevated levels of urate are the primary indicator that an individual has gout. The patient's test results show a plasma urate level of 10.5, which is significantly higher than normal, and his urinary uric acid levels is 215, which is much lower than the normal 413 plus or minus 78 range. Given what is known, these results lead me to believe that the patient has an overproduction of purines. I do not think that the patient has a decreased salvage of purines. Purine salvaging pathway consists of the synthesis of purine nucleotides by converting the intermediate compound hypoxanthine into either guanine or adenine, as shown in the diagram. Hypoxanthine, right here, is converted back into inosine via hypoxanthine guanine phosphoribosyltransferase, right here. Inosine then undergoes a reaction, which is not shown here, but with, it's shown right here, with phosphoribosyl pyrophosphate to form IMP, inosine monophosphate. Inosine monophosphate then can either undergo catalyzed reactions to regenerate purines, adenine, and guanine respectively. Decreasing the salvaging of purines would result in a decrease of uric acid in the blood. Furthermore, this decrease would conclude in an increase in uric acid present in the urine. This is because the kidney's functionality should still be functional and diffuse the uric acid concentration into the urinary system. These reasons are why I believe this patient does not have a decreased salvage of purines. Also, I do not think that this patient is experiencing a decrease in the urinary excretion of uric acid. This is because if there was a decrease in excretion, then there would be an increase in concentration of the urinary uric acid, since uric acid would accumulate in the urine. This vaguely explains the high concentration of plasma urate or blood urate. Additional information such as potential inhibition of regulatory enzymes may be needed. The potential impact of the switch to regular soda is very concerning. Beverages such as regular soda are high in fructose. Fructose is the only carbohydrate that is recalled in increasing plasma uric acid levels. This increase in plasma uric acid levels can create an increased risk of developing gout. Research has shown that consuming more than one serving of sugar-heavy beverages has a significant increase in the level of uric acid present in the plasma. This increase is coupled with an increased risk of developing gout or worsening its symptoms. Case number 4. Based on the recorded symptoms that the patient presents, the most probable vitamin deficiency is vitamin B12, although it is tough to diagnose since each of the 3 vitamins have many similar symptoms, including muscle weakness, diarrhea, loss of balance, fatigue, fast heartbeat, as well as numbness and tingling in the feet. What led me to believe that vitamin B12 is in deficiency is that the patient appears to have a beefy red tongue and is suspected to have megaloblastic anemia. One of the biggest causes of megaloblastic anemia is the deficiency of vitamin B12. I do not think that vitamin B6 is in deficiency for a few reasons. Some of the symptoms for vitamin B6 deficiency include a red and scaly rash, confusion, irritability, depression, and skin inflammation. Many of these symptoms do not appear to coincide with the patient's symptoms. I also do not think that the patient has iron deficiency, although there are some commonalities. Symptoms for iron deficiency include numbness and tingling in the lower body, pale skin, exercise intolerance, muscle weakness, and loss of balance. Also, vitamin B12 is key in red blood cell synthesis. A lack of blood can cause iron deficiency. Therefore, a deficiency of vitamin B12 can also lead to iron deficiency. The presence of megaloblastic anemia and low hematocrit level makes me believe that this patient has a primary deficiency in vitamin B12. Iron deficiency could be a consequence of the vitamin B12 deficiency. Vitamin B12 is an essential vitamin for purine synthesis. Vitamin B12 is a cofactor for the enzyme methionine synthase, located right here. And the other cofactor is vitamin B2. But methionine synthase is used to help convert 5-methyl tetrahydrofolates, and that will be converted into tetrahydrofolates right here. And this tetrahydrofolate will then undergo subsequent reactions to synthesize purines. A deficiency of vitamin B12 causes the impairment of methionine synthase activity. This impairment will lead to further decreases in the purine molecules. Additionally, this will also mean that there will be an increase of folate in the body, located right here somewhere. Too much folate in the body can cause several health problems, including an increased risk of cancer. One laboratory test that would be useful in testing folic acid concentrations would be useful as testing folic acid concentrations in urine samples. Decreased levels of folic acid in the urine may indicate that the patient has too much folic acid in their body. This finding could potentially diagnose the patient with a vitamin B12 deficiency. Additionally, a plasma urate test would be helpful in determining the concentration of purines that are being catalyzed into uric acid or urate. Low plasma uric acid levels may help healthcare professionals determine that there is an impairment of purine synthesis. Thank you very much.